put a smile on your face when you're moving from place to place. Good morning.
Viewers, welcome back this morning, and this is the Tobago Updates morning show, and we're coming to you live from the Port Mall, third floor, Port Mall, Lower Scarborough, Tobago. And viewers, this week it's all about International Women's Day, which is being commemorated on Wednesday, the 8th of March. But we celebrate all week long with an all-female cast, all-female guests, just for you. And who better to start off the week with none other than Nurse Karen Frank, who is the head nurse at the oncology unit attached to the Tobago Regional Health Authority, or the TRHA. Along with her this morning, we've got Miss Rose Ambrose, who is in charge of prevention and screening. She's a nurse, the nurse in charge of prevention and screening attached to the TRHA. Our focus today is on International Women's Day's activities, or the TRHA's International Women's Day's activities. Ladies, good morning and welcome.
Good morning. Thank you.
It's really good to have you on the program with us today. Now, I like the fact that we're starting off with you guys this morning. You know, when we talk about International Women's Day, we talk about women being able to, in fact, we wear so many hats. We take care of husband, we work we have our careers, we're doing so many things. And we oftentimes leave ourselves for last. So right now, the focus is on taking care of you first. So let's start with you this morning, Ms. Frank. You are the head nurse attached to the oncology unit.
Yes,
Give us an idea this morning of, I mean, you're there every day, Monday to Friday. What are the numbers looking like in terms of cancer coming into the oncology unit? More women, more men.
Good morning, and good morning to the viewers. We see a lot of both because we have breast leading in women and prostate leading in men. So we have equal share of men and women.
Wow.
The issue is they don't stop coming. We have a lot of breasts and a lot of men. Breast cancer, not only in women, also in men. We have one person being diagnosed, one female being diagnosed every day with breast cancer.
So you're
and
saying
we have
that
2 females dying every 3 days from breast cancer.
I think I
So the
need you to
issue is
repeat
real.
that needs to hit home and sink in.
We have one woman being diagnosed with breast cancer every day as we speak. This is Trinidad and Tobago statistics.
Right.
And we have 2 dying every 3 days.
From breast cancer.
From breast cancer. One woman, 1 out of 9 women will be diagnosed with breast cancer.
That's a lot.
It is definitely a lot, and we try to contain it as best as we can by telling or educating persons as to screening methods, prevention methods, but that's as far as we can go. Education.
And Rose, this is where you come. This is where you come in now, because you are in charge of screening and prevention attached to the TRHA. And when you see women coming, because you see this, I mean, I've been there. When women come to you, give us an idea of what the experience is like.
Okay, right. As you say, good morning, viewers. As you say, they come to us first. And education. Now, when a woman comes into the department and they come for pap smear, they don't say breast examination first. I am the one who would say, well, you're going to have one today. Right? And at that point, I would educate them on what they're looking for. I tell them the issues surrounding breast cancer and so on. I even give them that information for their daughters, their cousins, and so on.
The other women in their lives.
The other women in their lives, right? We do encourage men. I do teach men to do this too, right? Because the men are the ones sometimes that would say, you know, babe, something is wrong with that breast. It does not feel right. And
particularly if you know these breasts.
Exactly. And I've had a father coming in to make appointment for his daughter and so on, and I was so proud. Yes, so we do get a lot of women. We do a lot of breast examinations every day. And if we find any sort of abnormalities, we refer to the hospital, and this is where Nurse Frank may come in if something is really, really abnormal and cancer steps in.
All right. Is there still a fear and a taboo surrounding breast cancer in Tobago? I mean, you share the stats. One woman is diagnosed every day. 2 women are dying every 3 days. Is there still a fear, a phobia, taboo about talking about breast cancer, being diagnosed? Is it still hidden? Do people still, well, keep it a secret? Well, this one has. Does it still happen, or because of the numbers, because of the stats you just shared, is it now an open discussion?
It's not.
Oh yeah, to a point, it's not. You have half and half. Because some women will come into the department and say, listen, I want these babies checked.
Right.
And then you would have some who would say, I'm trying to get my sister to come, but she says she don't want nobody to see her breast. And so it's a sort of taboo in terms of what we were taught to, that the breast is a private area.
But
and
we
no
were
one is
taught to
supposed-
hide them when they started to come in. So our parents gave us the training bras. So we were taught to hide them. So
Yes.
There was even a joke some years ago. If a woman is changing her clothes in a room and a man walks in, the first place we cover would be here. We don't cover here.
Yeah.
We cover here. Why is that? Because we were taught to hide these. We weren't born with them, but as they started coming in, we were taught to hide, cover them up,
To cover them, yeah.
cover the tatas.
Yes.
All right.
So
Some persons talk about it, some don't.
Yeah. Some are very open, yeah, but some very closed, yeah.
Yeah.
For screening, they are open. For diagnosis, when the cancer is there, we don't get them talking about it. People hide when they have cancer. It's a taboo. I don't know. I am going to die. I don't want anybody to know. You're hiding.
Let me ask you, apart from the screening and the education, is there a support system in place for persons diagnosed with breast cancer, cervical cancer, prostate? Is there some type of support mechanism?
There isn't any concrete support mechanism. There is a support group for breast cancer made up of cancer survivors.
A functional group?
A functional group.
Right.
But there isn't a concrete support system to say, as soon as you diagnose, one of the referrals you get is to go here. No. You get referral to the oncology unit, and we at the oncology unit, the nurses and our lone doctor, we have to do everything for our patients.
Let's talk about the nurses and the lone doctor for this one oncology unit to service over 65,000 persons on the island. Let's talk about that lone doctor. Now, Nurse Frank, uneasy is the head that wears the crown. And I've been to the oncology unit several times, and we see the same nurses and the lone doctor. If you could be in charge for a day, what sort of changes would you make to be able to create the environment that is necessary for treating persons with cancer, women with breast, cervical, men with prostate? What sort of changes would you make if you could change it for a day?
The first thing I would do is to establish a support system, psychological support for the patient and their relatives.
Speak the truth. Go ahead.
Because the patients are really stressed. It's difficult for the patients and their relatives to cope. So the first thing we'll have is a counsel on board.
Right.
And then we'd move to expanding the unit. The place is very small. We do our best in the small space. But if we could have it expanded, we'll have a lot of services put in that would benefit them.
What are some of the services that you would go
Palliative care.
Go ahead.
Patient must need palliative care. It's a supportive care that they would need closer to the end of life. And we start palliative care from the beginning. Diagnosis. Dietitian support system.
Go ahead.
Patients just tend to, I don't know what to eat. As cancer step in, I don't know what to eat. A children support unit, because wow, we have a lot of young mothers. And they have children. A children support unit. We need something to care for the children. We must have that.
You're on the road. I mean, you're
We
talking there.
must have that.
And I'm thinking back to my treatment. My treatment was not in Trinidad and Tobago, but as you're talking, this is what I got. This is what I was exposed to. And I want to ask Rose here, nurse Ambrose, at this time, with regards to screening, persons coming in for screening. Give us an idea of the timeline between screening, and diagnosis, screening and results.
That is a touchy subject here.
Because I'm trying to make it make sense.
Yes, yes. The client comes in, do the pap smear. At this point in time, we have a sort of space between getting the results back in a timely manner. I've had to take it upon myself in the benefit of the clients, and to some clients would take their pap smear, their sides privately, and to get it back in a timely manner. But we are working on it, as I was told several meetings ago, that it's been worked on. So the time that they do the pap smear to the time that they get the results, what we need to do is have it back in a timely manner, just in case, yes, that you have like high grades, meaning precancerous cells being seen on the smear itself, in order for that woman to have the proper intervention and referral. So we do have a little time lapse between it, but as I say, we try whoever can go and get their pap smears in a week and a half, their results, then we facilitate them. But as I say, the TRHA is working on it.
They're working on it.
Yes.
Weeks to months is a long time.
It is.
And in some cases, it's over a year before some persons get the results. So by the time they screen, it's looking pretty bad.
Yeah.
And by the time they get the results, all hope seems to be gone.
Yes. Well, I won't say all hope is gone, because at that point in time, I do fight for my clients.
I understand.
I do. I mean, when I realized, look, 3 months, 4 months, I am up. Before that, I'm up at the hospital, at the lab. Perhaps they're tired of me, seeing me when they see me
but
coming.
We need to be people. We need to be able to trust the system. Yes.
Yes. So I do go and give a push, and sometimes they try their best to help, but you need to have that support system for them also. Right? We need more staff, I think, for reading the slides, for the cytology and so on. So yes, we do have a little lapse where results are concerned, because sometimes if you do a pap smear now and it comes back 6 months down the road that you have a high grade, the time that you did it, it was there.
That's right.
You understand? It was there. So you need quick intervention.
And that's what I'm saying here. This calls for a serious overhaul, because we're dealing with people's lives. At the end of the day, we're dealing with people's lives. I lost 2 friends in the space of 3 months late last year. And these are persons who would have gone through surgery, done chemotherapy. It was said to have been gone, and then mere weeks later,
they regressed.
It has returned, and they passed away. A viewer on the live is asking, how do you all deal psychological with breaking all this bad news? How is it? Now, I heard Nurse Frank, you mentioned a while ago, my question was, if you could change it for a day, what would you do?
What
and
will
you
I
did.
add?
Right. So how is it done now?
Let me just answer this. When the results come back to us, if it is high grade, meaning precancerous or so, I get the client in. I never give results by phone. I get the client in, and when they see, sometimes you call somebody and they say, oh God, I have cancer. I said, come in, let us discuss this. Don't start that yet.
Yeah.
And I would do my part of the counseling. I invite them to bring their relative in for support if they need to do so. Right? We always ask for next of kin when we are taking history. So that person, we ask for somebody who, if anything, we can, get extra help for that person.
Okay.
Yeah.
viewer on the live here is asking, but she said she's stating here that she got both done at the Scarborough Health Center and they were very professional. So that would be with you, Rose. No, Ambrose.
We try our best to create that environment for women.
And that is very true. I've been there, and you couldn't ask for a better person. I often say if it's one person, I don't mind seeing me. It's Ambrose, okay. But I joke about it, but I'm very serious. She's very professional. Her touch is very light. She knows what she's doing. She knows what she's looking for, and you feel very comfortable, and you don't feel embarrassed at any point in time. At any point, so I'm saying, yeah, get up, go, get screened, get
Please,
tested.
yes.
Okay, early detection is the best protection.
Yes, it is.
Okay.
It is.
All right. So, ladies, I want you here in wrapping up as we talk about International Women's Day, women taking time for themselves. How important is this, and why they should get up today and go out there and start the week off having an idea of where you are, what you're about, and what would be your next step?
Your health is your wealth. Without good health, you cannot achieve the numerous amount of things that we women would like to achieve, such as caring for the home, caring for the family, a whole host of things.
Yes. And I just want to highlight this. May I say to employers, please, when your female employees come to you and say, I'm going to have a pap smear or a breast examination, please give them that time to come. Because if they are not well, they can't come to work, right? Family would be losing income.
Yes.
Mothers, children will be losing mothers and so on. So please, I'm in the process of sending out letters to employers to ask them to partner with the TRHA to allow their female employees to have better health by coming to have their screening.
All right, a quick question coming in here, and it's for you nurses. As women, what do you all do for psychological self-care as a nurse? Because you'll see some things.
Yeah.
And it's not easy, some of the things that you see, and then you have to say some things, and it's not easy things that you've got to say.
Yep.
So how do you deal with it?
For me, I do outdoor stuff. I like outdoor stuff. I do hiking, I do running, I do gardening, I do outdoor stuff.
And you're able to break.
And I am able to deal with it. I have been in it for years, and I'm coping fine.
As she said, I've been in it for years, internationally and here, and I cope pretty well. I take it on board. At times, most of it, all the time I take it on board, but I distress myself. Why? Because I have to go the next day to deal with it again. Now, may I just say this quickly? Abroad, when I would have seen clients in this area, we have somebody to offload on at the end of the month.
Yes.
That was done for us. So it would be nice if there's somebody we can go to who we can offload if we need to and when we need to. Because we take a lot on board. It's not easy to see a client crying or having all that emotions. It's not an easy thing.
Yeah.
And we deal with it every day. Yes.
All right, and I say here, better steps, better initiatives need to be put in place for our women in Tobago. Very quickly here, one of the viewers on the live says, getting results for any test done in Tobago space is too long through the hospital. CT scan is the next one. I hear you loud and clear. Another viewer says, thank you all so much for that initiative. The workplace need to be compassionate towards their workers. Definitely. And this is a call, even as we speak, a call to the Secretary for Health, Dr. Faith B. Israel. More needs to be done. More needs to be done now. When we talk about cancer, breast cancer, cervical and prostate, we're talking about people's lives. We're talking about our mothers. We're talking about our fathers. We're talking about our daughters, our sons, our uncles, our grandparents, our aunties. We're talking about lives. So it's not good enough. It's not good enough to have screening today and results next few months. It's not good enough to have screening today and results next few years. Screening today, results in a matter of days. We can do it. The money is spread around, all around. Let some come to this area that has been neglected for so many years. We're talking about people's lives. So we want to thank you so much for joining us for this segment. We've got lots more coming up this morning on the Tobago Updates Morning Show. Ladies, we want to thank you for being with us this morning. And it was certainly a pleasure being able to get this back.
I would just like to invite each and everyone down to the Esplanade on Wednesday, the 8th International Women's Day, where the TRHA would have a health fair. Lots and lots and lots of giveaways from 9 until the end, which is at 4. So we'll have giveaways right through the day.
What day is that?
Wednesday, the 8th of March. That is International Women's Day on the Esplanade.
Thank you so much.
And they will be having information too, because you have different speakers coming to
Okay.
give a talk. Yeah.
All right. We're going to be there with bells on. All right, ladies, viewers, rather, we're going to switch gears. In fact, we continue this morning focused on women because it is International Women's Day 2023. And coming up next, Brittany is going to be chatting with Ornella Douglas, who is the business operations coordinator attached to TRHA. And it's all about TRHA through the years, TRHA's 25th anniversary. So lots more coming up on the program, viewers. Share the live, share the live, share the live.